Hi, my name is Erin Brownlee. I'm the registered dietitian and certified diabetes educator for the Shoshone-Bannock Tribes Diabetes Project. I have put together a series of videos using the materials from the International Diabetes Center and our tribe to help answer some of the basic questions of diabetes. In this video, I will discuss healthy behaviors to help manage your blood sugars, how weight loss can help your diabetes, how to identify glucose patterns, and tips for goal setting. In session 1, we discussed how type 2 diabetes can develop because of insulin resistance. As a result, your cells become less sensitive to the action of insulin. One of the ways you can increase the sensitivity of your cells, which improves how your body uses glucose, is by losing 5 to 10% excess weight. Some tips for healthy weight loss include: follow the healthy plate method. Make half your plate non-starchy vegetables. Fill a quarter of your plate with lean protein foods such as turkey and chicken breast, wild game such as elk, deer, and buffalo, fish, and low-fat pork and beef, or beans. Fill up the other quarter of your plate with whole grains or starchy vegetables such as potatoes, corn, and peas. On the side, include a piece of fruit or a half a cup of fruit, as well as a source of calcium such as milk or yogurt. Also, it's important to increase your daily movement. Physical activity will not only help you to lose that excess weight, but to lower glucose levels at the time of activity. Small increases in physical activity will provide these benefits. Slowly increase the time you are active over several weeks. You may start in smaller increments, such as 10 minutes at a time, and work up to more. The goal is to aim for 150 minutes per week. Now let's talk a little bit about identifying glucose patterns. In this session, I will add on to that by discussing how to identify glucose patterns and trends. Documenting every time you check your blood glucose can help with this. It is important for you to remember what your blood sugar goal is. Fasting blood sugar goal is 70 to 130. 1 to 2 hours after a meal, you want your blood sugar to be less than 180. You may begin to notice that there are certain times of day that your blood glucose is high or low. This is called a glucose pattern. A pattern is a way to recognize that there may be something in your care plan that needs to be changed. Identifying the cause can help you to change that pattern so that you can reach your target range. For example, a consistent high blood glucose result after the evening meal may signal to you and your healthcare team that a change is needed. Some options for this may include a decrease in the portions of food at that meal that may cause your blood sugars to go too high, to take a walk in the evening to help bring blood glucose down, or your healthcare provider may want to increase or add a medication. It is also important for you to be aware of your day-to-day patterns and glucose trends. For example, an isolated event of a low blood glucose is not cause for a medication change, but a review of how it happened can prevent further occurrences. In this example, did you go too long between meals? Were you more physically active than usual? Did you accidentally take more medication than you usually do? Remember, identifying your glucose patterns and knowing when to get your healthcare team involved is vital for the best diabetes control and outcomes. Goal setting is a way to help you to make changes that will keep you living well with diabetes. Goal setting helps to focus on your successes as well as be mindful of your actions and behaviors. In order for goal setting to be useful, your goal needs to be practical, measurable, and realistic. A practical goal is something that fits into your daily life. A measurable goal provides you with a way to recognize your success. A realistic goal is a doable goal. Make sure to pick a goal that you feel good about doing. Focus on what you want to change or achieve. Keep in mind your health needs, your schedule, resources and support, and what you are able to do. Remember, you are much more likely to make a change when you feel it is important and have confidence that you can do it. For further information regarding any of the topics we have covered in this video, please contact the Shoshone-Bannock Tribes Diabetes Project for an appointment.